The main alternative in psychology, which I've mentioned before, is the DSM, the Diagnostic Statistical Manual, which is highly regarded and highly respected and used by the majority of modern healthcare systems in the West. So they define a psychological disorder as a clinically significant disturbance in cognition, emotion, regulation, or behaviour that indicate a dysfunction in mental functioning that's usually associated with significant distress or disability in work, relationships, or other areas of functioning. So you can see in that definition they've sort of captured all of the things from before, like personal distress, impacts to society, behavioural problems, violation from the normal behaviours, and they've made a really important point at the end: expectable reactions to common stressors, so things like war, the loss of a family member, highly stressful work environments, academic stress. They do not count those as mental disorders. They've made a very clear distinction between normal human emotions in reaction to normal human everyday experiences versus psychological or psychiatric illness. And the DSM-5, just for some context, contains 300 mental illnesses. That's a lot, and I'm sure that number might surprise you. And they all fit into 5 categories. So, here are some of the main disorders that the DSM-5 list. Can you point out any here on this list, just looking at it, that might be considered character flaws? Even just from the language. Ones that jump out to me would be social communication disorder at the bottom, potentially conduct disorder, potentially disruptive mood dysregulation disorder, intellectual disability, personality disorders, because these, if you remember from our discussion on character flaws, are very similar in language to those character flaws. So again, we're seeing that overlap between them. How do we diagnose psychiatric disorders then? We've defined them, but how do we diagnose them? And this is how the DSM-5 does it.